Hi everybody, it's Gemma here from the UK, and I'm talking to you from Eastbourne where I live. I'm really sorry that I wasn't able last minute to fly to Kigali to be with you for the workshop in person today. I just wanted to take a second to reintroduce myself to all of you. So I'm a social anthropologist and I was working with the 5S Foundation in the UK. And my part of the work on the 5S Foundation was to try and understand everybody's different perspectives on how NTD policymaking happens in practice. And hopefully some of you will remember me from our joint AGM in October 2022, where you very kindly gave me permission to do some observations of the meetings. These days, I've started to help out GHRU a little bit with doing some thinking around the impact planning. I'm now going to give you a short introduction to what is understood by impact by the funders and the other people that we work with within GHRU. Thank you. So, impact and the GHRU. This introduction is really for us to just all make sure that we are all talking about the same thing when we talk about impact. So what do we mean when we are talking about impact? What is impact? Impact is a term which is commonly used by funders and universities, but it could probably be better described with other words such as changes, benefits, and effects. And it really just means these three things. One, identifying the real world changes you want to see happen because of your research. This is often also called outcomes, and this is a little bit different from research findings. Number two, it means working out the steps that you're going to take to help make those changes happen, and this is often called the pathways to impact. And number three, it's about making sure that you can provide evidence that change has happened, and that's often called evidence of impact. So this means that impact actually involves, number one, thinking about what things can our research change and who might benefit from this change. Number two, thinking about what we can do as researchers to help make such changes happen. Number three, making some concrete plans about what to do, who else we need to involve, when we need to involve them, and what we need to do this, resources basically. And number four, keeping a good record of all the things we did. And number five, and this is particularly important for NIHR, collecting evidence about the actual changes that occurred or are occurring because of all this hard work that we've done. So impact is often described as meaning change that is non-academic. And this doesn't mean that academics like us aren't involved in that change. It just means that our research, and we can show our research, results in real life political, economic, social, health, or environmental effects. And as I'm sure you're all really aware, it's often a little bit out of our control as to whether our research can lead to real life changes. However, there are lots of things that we as researchers can do and have maybe a responsibility to do to try to make our research more impactful. And it's never too late in a project to start working on this. It might be too late to change your research questions, but it's never too late to try and help the answers that you find out have a real world impact. So what this actually means is, from the point of view of funders and other organizations and people that we might be talking to about impact, impact is not considered things like this: community engagement activities, dissemination, which might include media or policy engagement, our reputations as the expert in academic circles or elsewhere, the kind of attention that we get, so the number of views on YouTube, how many followers we have on X or LinkedIn or Telegram, standalone clinical trials, tests or surveys, any public talks we do or webinars or presentations, even things like setting up active community advisory boards, or the papers that we submit and get accepted in journals with high impact factors. Now, all of those things are super important, and all of those things are useful or necessary or important steps or pathways to impact, but they're not on their own considered evidence of any real world changes that happened as a result of our research. So what might be a real life change? And there's lots and lots of diverse things that could be counted as a real life change. And it's really up to us to make an argument to funders and the universities that these are real life changes. And this could be things like this. For example, a pilot treatment intervention of a research program gets rolled out by a government, and you can provide some evidence that this happened. Or a new protocol for how to do wound care gets incorporated into a health professional's training manual, and you can provide some kind of evidence this happened. Or some people's minds are changed a little bit about a stigmatizing disease, and you can provide some kind of evidence this happened. Or the capacity of a lab to do something is increased, and you can provide some kind of evidence this has happened and what it means in real terms. Or maybe there's a change in a policy somewhere, and you can provide some kind of evidence that this has happened and how you and your research contributed to that. So it might really be impossible, and it probably is, or maybe not actually, to achieve some of these big things within a small project's lifetime of like 5 years or something like that. But you can usually find some kind of evidence that these changes are on the way coming and that you help them to happen in some way. So why does this all matter? Now, the most important reason, and this is to me personally, and I'm hoping it's to you too, and I'm sure it is to some of you, is that the reason we all want and love to do health research in the first place is to try and leave the world a little bit better than we found it. So while, as I said before, we often don't have that much control or power to make these big changes that we want to see, we do have some responsibility to do as much as we can to help the process along. And as I'm sure you all know, we can't really assume other people are going to do it for us or that they perhaps care about it as much as us. Because after all, it might be our PhDs or our postdocs or our life's work, but it's not other people's. The second important reason is that to continue doing what we love and demonstrate to other people that what we love is making a difference in the world, we've got to show funders and our universities that our research is important in the real world outside of academia. So when you think about this specifically in the context of research funded from the UK, this is particularly important because these days external funders and what's called the Research Excellence Framework, or REF, include it within their assessment criteria. So REF is the UK system for assessing the excellence of research done in partnerships with UK universities, and REF outcomes are used to inform the allocation of around £2 billion a year of public funding for universities' research. But nevertheless, anyway, all funders usually want to see some kind of evidence of impact in the final reports that we give them, and your past track record in impact, and that's both as an individual person and in groups of teams or new collaborations, is really important to show in new applications for funding. So what the NIHR describes as impact is what probably we really need to think about, because they're the people that we're going to be talking to when we're thinking about demonstrating the impact of this program and possibly for applying for new funding. So this is what they describe as impact: making meaningful differences to people's lives through the research we fund and support. Research impact is defined as the demonstrable contribution that research makes to society and the economy, of benefit to individuals, organizations, and nations. So you can see here that they use the word demonstrable. So really we need to show them or demonstrate to them how our research does this. Then secondly, they write here, we prioritize the challenges that are most important to those who use, work in, and manage health and social care services, and that could most benefit from research evidence. And that gives us a bit of a clue as well to what they're looking for, which is research that can be used in everyday life and will have a difference to the end users of the research. Then you can see here they also say we accelerate the translation of discoveries and partner with others to ensure our evidence is used to improve everyday practice. And I suspect that's something to do that might be really useful for lab people, because here they're not just looking that you've made a discovery, but also that that discovery is going to be or can be translated and used in the real world. And finally, we track progress against our goals and strive to ensure that our research addresses the needs of patients, service users, carers, communities, and the public. And here the buzzwords there is tracking progress. So we need to find a way to show them. And it's important for us too, as well, I think, that we're thinking about how things are going, we're tracking it, and we're able to keep an eye on what we're doing. So what I think is really important to say as well is that I've had the lucky chance to look at everybody's impact prep work, and it's absolutely clear that everyone is already doing impactful stuff and already knows how best to do it in your particular context. So this particular workshop is really about helping everyone in the different themes and across the whole of the program just agree on their plans, share different ideas, get some feedback from each other, and then be able to document it in a way that the funders that we're working with can realise and can see. Thank you very much. I'm now going to hand over to Tom and Jenny, and who are facilitating the day. And I hope you have a brilliant day, and I hope to be able to see you in person sometime. Thank you very much.